Hello. So I thought I would hop on here while I do this, go live, show you guys a little bit of the behind the scenes of everything. So just a heads up, I am likely going to not be answering questions as I'm doing this. So I am just getting something typed up here real quick so that you guys can know what I'm doing as I'm doing it, and it's not a what's the word? I'm not ignoring you guys. So I'm going to put this here and I'm going to pin it so everybody. I should be a moderator. Hang on. I have to add myself as a moderator on my other, so give me just a second here. Moderators, here we go. All right, so it's telling me I have access to pin the comments, but it's not letting me pin a comment. Hey guys, how are you all doing? Sorry, my thing is shaking a little bit because I'm trying to type. So it'll stop shaking here in just a minute. I don't know why it's telling me I'm moderating it, but it won't let me actually do anything. Hold, please. Not necessarily hold, but you know what I mean. This one, his name is G. I'm trying to, let me get this comment pinned so that everybody's going to be able to see it. But so we're actually not doing like quote unquote lessons or anything. I am just going to be recording a couple lectures, and then you guys are just going to be here while I'm doing it. So obviously ignore all of the clutter that's on my desk underneath. I feel like I clean it and do all the things and then it goes right back. Actually, let me get some of this random paper out of the way. You got your books the other day. Awesome, Renee. All right, guys. So I am going to essentially just start recording things. Oh, I'm going to pop out real quick and do something, and then I'm going to pop back up. But you guys are going to be able to see some of the behind the scenes stuff that happens whenever I record. You'll probably hear, to be totally honest, there's going to be times where I know how to read, but I can't read all at the same time. So there is, you probably hear me say the same slide over and over again sometimes. And that is just because, oh, I don't want to do that one. Hang on. I want to do a different one. It's just because I am a perfectionist and I don't want, to have, what's the words I'm trying to say? Like, as I'm doing a lecture, if I'm going to be like offering this as part of a course, I want it to be fluent type thing. So you'll probably hear me say the same slide over and over again. And that's just because, like I said, I am, going to be, nope, hang on. I keep hitting the wrong buttons. Here we go. I'm just going to be, making sure that it flows good enough for my liking. So just know that it may not be. But yes, you guys can absolutely 100% take notes as I'm doing this if you want. But any questions that you guys ask in the chat, I probably am not going to see them or be paying attention to them. So that way I'm not trying to read and talk all at the same time. And all of that. So, all right. Sorry, I didn't have a note on this slide, so I am trying to, do something real quick so that way it's at least somewhat, I'm not just rambling. All right, so here we go. Welcome to Module 3 for Pharmacology. In this lecture, we will cover the basics of pharmacology, and this is not meant to replace an entire pharmacology course, but to give a high-level overview. The basic principles of pharmacology will include the study of drugs, their respective actions, the dosage and administration, therapeutic uses, and adverse effects. Drugs are given 3 names. You have the chemical name, the International Non-Proprietary Name, or the INN, and this is also known as the generic or non-proprietary name, and then you have your brand name. The chemical name is going to be the scientific name, and it is based on the molecular structure of the drug. Chemical names will describe the chemical makeup of the drug, and the actual name is going to be long, complex, and generally is not used. When approved by the FDA, the drug is given its generic name, or a shortened version of the chemical name, and this is going to be considered the drug's official name. The generic name is non-proprietary, and it does not belong to any one manufacturer. See, and here I am where I'm going to have to record that because I did not expect, I forgot that I had a drug name on here, and I've got to Google how to say it, because I do not want to say it incorrectly. So I'm over here literally Googling how to pronounce a certain solanezumab. See, I would have never figured that out. I would have butchered that one with my country accent. It's really not even that country, but... So, solanezumab. That's a fun one. Okay, so I'm going to re-record that slide. So see, when I say I'm doing this and I'm recording things, I have to like do some slides like 3 and 4 times. So sometimes that's why it takes longer for me to get things done. When approved by the FDA, the drug is given its generic name, or a shortened version of the chemical name, and this is considered the drug's official name. The generic name is non-proprietary, and it does not belong to any single manufacturer. The drug solanezumab, see, and now I'm going to struggle with saying it. Solanezumab. Solanezumab. See, this is where I struggle. So when I sound like I just ramble things off, I have to say it 8 times before I can actually do it. So let me actually write Solanezumab. Okay. I had to write it out in phonetically in order for me to hopefully say it right the 3rd time. When approved by the FDA, the drug is given see, now I'm struggling over just simple words. When approved by the FDA, the drug is given its generic name, which is a shortened version of the chemical name, and this is considered the drug's official name. The generic name is non-proprietary, and it does not belong to any one manufacturer. The drug solanezumab is a drug that is used in the treatment of Alzheimer's disease, and it is a humanized monoclonal antibody. The antibody is designed to bond different peptides, which make up the protein plaques found on the neurons of Alzheimer's patients. The generic name can be divided into 2 parts, Solane and Zumab. So the stem Zumab identifies the drug class as a humanized monoclonal antibody. Finally, the brand name or the trade name is the patented name of the drug. It is selected and is the property of the manufacturer. The brand name or the trade name will be protected underneath copyright. The routes of administration can be classified into 3 types. Topical, which is the local effect, with the substance applied directly to where its action is desired. Then you have enteral, which is the administration that involves any part of the gastrointestinal tract, and it has a systemic effect. And then you have parenteral, which is the substance that is taken into the body in a manner other than through the digestive tract, such as intravenous or a intramuscular injection. I'm going to re-record that one because I didn't like the way I said that last sentence. The routes of administration can be classified into 3 types. First is topical, which is the local effect, when the substance is applied directly where its action is desired. Enteral is the administration that involves any part of the GI tract as it has systemic effects. And then parenteral is when the substance is taken into the body in a manner other than through the digestive tract, such as intravenously or intramuscularly injected. Examples of topical administration will include epicutaneous, which is the application onto the skin, such as for allergy testing, and topical, I do this. This is, it's not pretty behind the scenes, guys. Examples of topical administrations will include epicutaneous, which is the application onto the skin, such as allergy testing and typical local anesthesia. Then you have inhalation, such as asthma medications and eye drops. And then you also, hang on, I don't know what that last sentence is supposed to say. Oh. Okay, hang on. See, sometimes it's been a while since I've created this slide deck, so, okay. I need to reword, not necessarily reword it, but I need to change the way that my notes are structured so that So see, here, let me show you what I'm actually doing here real quick. So I'm changing down here. I'm changing the way that it's written. So while you're not really seeing much up here, I'm still doing something down there. So, and I keep struggling with now getting it back up to where I want it from a... So it's frustrating because I know how to read. I know how to read, obviously, right? But it's almost like when you are, like a lot of students, and I'll put this in perspective for you guys, when you guys are students, you know what you're doing, right? But whenever you're being tested on it, or when someone is listening, or you know someone is going to be listening to you, then it just, like, it's not like a nerve thing. It's just your brain just, like, convinces yourself that you don't know how to read. All right. So some examples of topical administration will include epicutaneous, which is an application onto the skin, such as for allergy testing, and then your local anesthesia. And then inhalation, which will include asthma medications and eye drops that are placed on the conjunctiva, such as antibiotics for conjunctivitis. Enteral administration is going to be an administration that involves any part of the digestive tract. So some examples will include oral, which will be by mouth, or a route of administration for tablets, capsules, drops, or liquids. And then you'll have gastric feeding tubes, duodenal feeding tubes, or gastrostomies. And this can serve as administration for pharmaceuticals and enteral nutrition. And then lastly, we have rectal, which is going to be various drugs that can be administered via suppositories. Intravenous, intraarterial, intraosseous, intramuscular, and intrathecal will all be examples of parenteral routes of administration. In intravenous administration, the pharmaceutical is administered into a vein. For intraarterial, the medication is injected into an artery. So some examples of, again, I started, as soon as I stumble on one word, I do it. So let me change this formatting here real quick so I can easily see. I had it all in one long paragraph, but now I see that I need it in bullet points. Hey Shannon, how are you doing? All right, I think I got it. All right, fingers crossed. Fingers crossed this is it. Intravenous, intraarterial, intraosseous, intramuscular, and intrathecal are all examples of parenteral routes of administration. For intravenous administration, the pharmaceutical is administered directly into a vein. For intraarterial, the medication will be injected into an artery. So some examples would be vasodilator drugs in the treatment of vasospasms and thrombolytic drugs for the treatment of embolisms. Intraosseous infusions will be infusions of the pharmaceutical into your bone marrow. It is considered an indirect IV access because the bone marrow drains directly into the venous system. And then lastly, we have our intramuscular, which is going to be an injection into the muscle, while intrathecal is an injection into the spinal canal. Now that we have gained an understanding of nomenclature and administration routes, we are prepared to move on to a dissection. It's supposed to be discussion, not a dissection. Sadly enough, like, I'm not just saying these things out loud, like, as I'm like noticing that I'm saying things wrong because I'm talking to you guys. Even when I'm not recording, like I'm not doing live or like anything like that, I still talk to myself while I'm doing it. I'm like, that's not the word that you, like, your brain is seeing. So now that we have gained an understanding of nomenclature and the administration routes, we're prepared to move on to a discussion of pharmaceuticals. The remainder of our discussion will be organized into drugs that are used in the treatment of body system disorders, antimicrobials, antifungals, and anti-cancer drugs. We will explore the classes of drugs and the conditions that they are used to treat, side effects, and commonly known names. So anti-anginal drugs are used in the treatment of two common types of angina pectoris, stable and unstable. Stable angina is chest pain or discomfort that usually occurs with activity or stress, while unstable angina is chest pain that occurs during periods of rest. Your unstable angina is also referred to as acute coronary syndrome. The most common cause of unstable angina is reduced blood flow to the heart muscle due to atherosclerosis. Common drugs used in treatment are nitrates, beta blockers, and calcium channel blockers. Nitrates cause vasodilation, and they are both long and short-acting nitrates. Short-acting are used to abort angina attacks, while the longer-acting nitrates are used in the prophylactic management of the condition, preventing their occurrence. The common agent found in nitrates is nitroglycerin, and the common effect of nitrates include headaches, dizziness, lightheadedness, and flushing. Beta blockers is an anti-anginal drug that are used prophylactically by reducing the work of the heart that is allowed to perform to a level below which would provoke an angina attack. Commonly recognized beta blockers are metoprolol and sotalol. Calcium channel blockers are also known as calcium ion antagonists and are used to treat chronic stable angina. These drug classes are assigned to classes. These drugs are assigned to classes. So now I have to record that entire thing when I was literally on the second to the last sentence. I'm sorry, I knew that was coming. That's why I was taking a second to start recording again. Anti-anginal drugs are used in the treatment of two common types of angina pectoris, stable and unstable. Stable angina is chest pain or discomfort that usually occurs with activity or stress, while unstable angina is chest pain that occurs during periods of rest. Unstable angina is also referred to as acute coronary syndrome. The most common cause of unstable angina is reduced blood flow to the heart muscle due to atherosclerosis. Common drugs used in treatment are nitrates, beta blockers, and calcium channel blockers. Nitrates cause vasodilation, and there are both long and short-acting nitrates. Short-acting are used to abort angina attacks, while the longer-acting nitrates are used in the prophylactic management of the condition, preventing their occurrence. The common agent found in nitrates is nitroglycerin. The side effects of nitrates include headaches, dizziness, lightheadedness, and flushing. Beta blockers is an anti-anginal drug that are used prophylactically by reducing the work that the heart is allowed to perform on a level below that which would provoke an angina attack. Commonly recognized beta blockers are metoprolol and sotalol. Calcium channel blockers are also known as calcium ion antagonists, and they are used to treat chronic stable angina. These drugs are assigned to classes. So examples of the calcium channel blocker classes are class 1, class 2, and class 3. Antihypertensive drugs are used in the treatment of hypertension. The use of antihypertensive will sorry, my throat got a little weird there. Antihypertensive drugs are used in the treatment of hypertension. The use of antihypertensives will prevent the complication of high blood pressure, stroke, and MIs from occurring. The most widely used antihypertensive are thiazide diuretics and ACE inhibitors. They are also used in the treatment of congestive heart failure and symptomatic edema. ACE inhibitors are used to treat hypertension and CHF. This drug class will also cause blood vessel dilation, resulting in decreased blood pressure. Common ACE inhibitors are and again, I'm going to struggle with saying the drug names. Enalapril, lisinopril, and ramipril. That's the thing that trips me up on some of these, especially like your drugs, is the generic names and the fact that I always want to put emphasis on the wrong syllable. Sorry, I had to close the door because my husband came home, which I probably was going to need to record that slide anyways because it had a lot of background noise on it. I have to find a way to like soundproof my door so that when the dogs are running around and stuff. If generics are hard, the chemical names, it's impossible for me to even attempt to say chemical names. So it's definitely, it definitely like you have to kind of like center yourself for a minute when you're doing that. All right, let's try again. Antihypertensive drugs are used in the treatment of hypertension. The use of antihypertensives will prevent the complication of high blood pressure, stroke, and MIs from occurring. The most widely used antihypertensives are thiazide diuretics and ACE inhibitors. They are also used in the treatment of congestive heart failure and symptomatic edema. ACE inhibitors are used to treat hypertension, not hypertensive. All right, third time's a charm, right? Antihypertensive drugs are used in the treatment of hypertension. The use of antihypertensives will prevent the complications of high blood pressure, stroke, and MIs from occurring. The most widely used antihypertensives are the thiazide diuretics and ACE inhibitors. They are also used in the treatment of congestive heart failure and symptomatic edema. ACE inhibitors are used to treat hypertension and CHF, and this drug class also causes blood vessel dilation, resulting in decreased blood pressure. Common ACE inhibitors are enalapril, lisinopril, and ramipril. The next group of drugs are those that are used to treat the endocrine system disorders. In this class of drugs, you will find common medications to treat diabetes and thyroid system disorders. So your endocrine system is instrumental in regulating mood, growth and development, tissue function, metabolism, and reproduction. In general, the endocrine system is in charge of body processes that happen slowly, such as your cell growth. The endocrine system includes the pancreas, ovaries, testes, pituitary, thyroid, and adrenal glands. Endocrine disorders will include diabetes, hyperthyroidism, and hypothyroidism. The drugs used in treatment of these diseases are corticosteroids, diabetes mellitus drugs, and lipid-lowering drugs. Corticosteroids are related to corticosteroid hormones that are produced by the body. The production of corticosteroid hormones by the adrenal glands is regulated by corticotropin, a pituitary hormone. These drugs are used to treat inflammatory conditions that may affect the joints, skin, digestive tract, respiratory system, eyes, and ears. If the body is unable to produce sufficient natural corticosteroid hormones, then corticosteroids may be prescribed as a replacement therapy. Addison's disease and hypopituitarism are examples of conditions that result from the body's inability to produce corticosteroid hormones. So in short-term use, corticosteroids will rarely produce any side effects. However, with long-term use, side effects will include bruising, weight gain, increase in blood pressure, and osteoporosis. Abrupt discontinuation of high-dose corticosteroid side effects will include bruising, weight gain, increase in blood pressure, and osteoporosis. Commonly prescribed corticosteroids will include cortisone, prednisone, methylprednisolone, and hydrocortisone. I feel like I've repeated myself there for a second. With long-term use, side effects can include bruising, weight gain, increase in blood pressure, and osteoporosis. And then the abrupt discontinuation of those can also do the bruising, weight gain. Okay. Sorry, my throat's itching. I know I'm going to cough here in a second. Drugs used to treat diabetes are probably the most commonly recognized. In order to understand the physiology of the prescribed medications, we must first understand the disease process itself. In diabetes mellitus, levels of blood glucose are too high because the body produces too little or is too resistant to the action of the hormone insulin, which is secreted by the pancreas, and it regulates blood pressure. So diabetes mellitus drugs will keep our blood glucose at normal levels. You have two types of diabetes mellitus. In type 1, the body does not produce sufficient insulin, and synthetic insulin is needed. In type 2, the body tissues have reduced sensitivity to the action of insulin. Mild forms of type 2 diabetes may be controlled by making changes to the diet and without having to use any drugs. I'm going to listen to that because I feel like I said some things weird. So let me listen real quick. Drugs used to treat diabetes are probably the most commonly recognized. In order to understand the physiology of the prescribed medications, we must first understand the disease process itself. In diabetes mellitus, levels of blood glucose are too high because the body produces too little or is too resistant to the action of the hormone insulin, which is secreted by the pancreas, and it regulates blood pressure. So diabetes mellitus drugs will keep our blood glucose. It regulates blood glucose, not blood pressure. I knew I said something funny in there. Can you all see? No, you all can only see the the screen that I have up. Okay. Drugs used to treat diabetes are probably the most commonly recognized. In order to understand the physiology of the prescribed medications, we must first understand the disease process itself. In diabetes mellitus, the level of blood glucose is too high because the body produces too little or is too resistant to the action of the hormone insulin, which is secreted by the pancreas and regulates blood glucose. Diabetes mellitus drugs will keep blood glucose at normal levels. There are two different types of diabetes mellitus. In type 1, the body does not produce sufficient insulin and synthetic insulin is needed. In type 2, the body tissues have reduced sensitivity to the action of the insulin, and therefore mild forms of type 2 diabetes may be controlled by making changes to diet without having to use drugs. Injections of insulin are given to replace missing natural insulin. This replacement will mimic the body's normal patterns of insulin production. Most insulin is genetically engineered to be identical to human insulin. You do have several types of insulin preparation whose durations of action will differ. Short-acting insulins are taken 15 to 30 minutes before meal times, giving high levels of insulin in the blood to coincide with high levels of glucose. Longer-acting insulins are taken once or twice a day. Many people will take a combination of both types. The dosage is going to be calculated to meet an individual's need, and insulin cannot be taken orally as it is destroyed by stomach acid, therefore it's always injected. If long-acting insulin is ineffective and fails to provide adequate control, an insulin pump can be utilized to provide timed doses. Anti-diabetic drugs, hang on just a second. What are you doing? Okay, she's gonna have to stop. Sorry, my husband opened the door and let the dogs in, but I was trying to get them back out. I was gonna have to stop anyways because I need to look at a pronunciation of a word that I have. Biguanides. Biguan? I don't know, hang on, we're gonna have to. Biguanides? Biguan? I really don't know how to say this word. Hang on, we're gonna have to listen to a video because
today you and tomorrow you aren't the same person. If you're tired of what today you is doing,
I don't know that I've ever seen this drug, so I have to wait for the
tomorrow you in just 6 months.
The ad on the YouTube to go away.
Biguanides.
Biguanides. I don't know that I would have ever figured that out. Biguanides. And I have this like written 4 times in this paragraph. So, say a prayer for me that I can get this because this one's gonna be a hard slide. All right, so we got to go all the way back to the beginning. Biguanides. Biguanides. Okay. Injections of insulin are given to replace missing natural insulin. This replacement will mimic the body's natural patterns of insulin production, and most insulin is genetically engineered to be identical to human insulin. There are several types of insulin preparation whose durations of action will differ. Short-acting insulins are taken 15 to 30 minutes before long meals. Before meal times, not long meals. I don't know where I got long. So see, when I say I'm doing something behind the scenes, like this is why it takes me 8 times longer than what it actually like sounds like it is. So injections of insulin are given to replace missing natural insulin. This replacement will mimic the body's normal patterns of insulin production. Most insulin is genetically engineered to be identical to human insulin, and you have several types of insulin preparation whose durations of actions will differ. Short-acting insulin is taken 15 to 30 minutes before meal times, giving high levels of insulin in the blood to coincide with high levels of glucose. Longer-acting insulins are taken once or twice a day. Many people will take a combination of both types, and the dosage is going to be calculated to meet an individual's need. Insulin cannot be taken orally as it is destroyed by the stomach acid, therefore it has to always be injected. If long-acting insulin is ineffective and fails to provide adequate control, an insulin pump can be utilized to provide doses over time. Anti-diabetic drugs will include biguanides and sulfonylureas. Biguanides are used to treat type 2 diabetes, and they will increase the utilization of glucose by the tissues. The biguanides are effective for patients who are overweight or those of normal weight who are unable to control the diabetes through diet alone. The effects of biguanides will include diarrhea, abdominal bloating, low appetite, and facial flushing. Generally, the side effects will disappear within the first few weeks of use. The most commonly prescribed biguanide is metformin. Sulfonylurea drugs will stimulate the insulin-producing cells in the pancreas to increase insulin. This stimulation helps compensate for the low sensitivity of body tissues to insulin that occurs within type 2 diabetes. The sulfonylurea drugs are taken orally once or twice a day in combination with dietary restrictions. Side effects of your sulfonylureas will include increased appetite and weight gain. Commonly prescribed sulfonylurea are glucotrol, Amaryl, and Oronase. All right, I gotta listen to that because I don't know if you heard the dogs. I know you all can hear the dogs squeaking in the background, but I've got some settings on my computer. Injection as to provide doses over time. Anti-diabetic drugs will include biguanides and sulfonylureas. Biguanides are used to treat type 2 diabetes, and they will increase the utilization of glucose by the tissues. The biguanides are effective for patients who are overweight or those of normal weight who are unable to control the diabetes through diet alone. The effects of biguanides will include diarrhea, abdominal bloating, low appetite, and facial flushing. Generally, the side effects will disappear within the first few weeks of use. The most commonly prescribed biguanide is metformin. Sulfonylurea drugs will stimulate the insulin-producing cells in the pancreas to increase insulin. This stimulation helps compensate for the low sensitivity of body tissues to insulin that occurs within type 2 diabetes. The sulfonylurea drugs are taken orally once or twice a day in combination with dietary restrictions. Side effects of your sulfonylureas will include increased appetite and weight gain. Commonly prescribed sulfonylurea are glucotrol, Amaryl, and Oronase. Okay. I'm always like super paranoid that people can hear the dogs going crazy in the background. So if anybody has any tips on how to soundproof a door, because I have a towel usually underneath at the bottom where there's the big crack, but I still feel like so much sound comes in between, like in through the door, because it's a panel door, so it's hollow. I think I'm just gonna have to break down and buy a solid door, like a slab door. Sorry, I've got some. Yeah, Shelby, I've thought about the foams, like the peel and stick ones, and I know that those are like good for walls, but I don't know that it would really do a whole lot for the door, if that makes sense. So I don't know. I need to just do a research. I'm like, the door is cracked from where we were moving and something hit it, so I probably need to just replace it anyways and just suck it up and do a whole, just get a whole brand new door. But I don't know. I have to, like, I'll sit here and think about it for 6 months and then I'll just break down and finally do it. And it's funny because, like, when it's just me here, like, they're calm and they're quiet and they're, like, super chill. But as soon as my husband walks in the door, like, you would think that, and he doesn't do anything. He literally just walks in the door and they just lose their ever godforsaken mind. Have the dogs in here with me? No, they would just whine because the door's shut. It's like, I'm damned if I do, damned if I don't with them. All right, let's try this one again. Well, no, we didn't even try this one. I was trying to read and make sure I didn't have any. Carbamazole, neomercazole, and Vidalta. Okay. Hyperthyroidism is a disorder in which an overactive thyroid gland will secrete excessive amounts of thyroid hormones. The symptoms of hyperthyroidism will include weight loss, persistent tremor, and rapid, sometimes irregular heartbeat. Hyperthyroidism will require long-term treatment. See, I hear long-term and my brain just goes long-term use of insulin. Hyperthyroidism is a disorder in which an overactive thyroid gland will secrete excessive amounts of thyroid hormones. The symptoms of hyperthyroidism will include weight loss, persistent tremor, and rapid, sometimes irregular heartbeat. Hyperthyroidism will require long-term treatment, and anti-thyroid drugs. See, and Shelby, I'm the same way. I have hypo, and so my brain always goes to hypo instead of hyper, so I'm having to, like, hyper think about the word hyperthyroidism, and it's throwing me off. Hyperthyroidism is a disorder in which an overactive thyroid gland secretes excessive amounts of thyroid hormones. The symptoms of hyperthyroidism will include weight loss, persistent tremor, and rapid and sometimes irregular heartbeat. Hyperthyroidism will require long-term treatment, and anti-thyroid drugs are taken on a daily basis and require monitoring through blood testing. Symptoms of hyperthyroidism include weight loss, persistent tremor. Hang on, why does it say that twice? The symptoms of hyperthyroidism include weight loss, yada, yada, yada. Okay, hang on. It's in here twice, so I've got to figure out why I put it in there twice and how to word it. So hyperthyroidism requires long-term treatment. Symptoms are weight loss, persistent tremor, and rapid, sometimes irregular heartbeat, which should begin to improve over a period of 1 to 2 months. Hyperthyroidism is a disorder in which an overactive thyroid gland secretes excessive amounts of thyroid hormone. Hyperthyroidism requires long-term treatment. Anti-thyroid drugs are taken on a daily basis and require monitoring through blood testing. Symptoms of hyperthyroidism will include weight loss, persistent tremor, and rapid, sometimes irregular heartbeat, and these should begin to improve over a period of 1 to 2 months after the medication is introduced. The most common antithyroid drug is carbamazole, which is sold under the brand names of Neomercazole and Vitalta. Antithyroid drugs are also known to produce side effects that are generally mild in nature. The side effects can include nausea, headache, rashes, itching, and joint pain. And in rare instances, the carbamazole has been linked to the reduced production of white blood cells. Speaking of itching, I have been struggling with allergies and my skin has been crawling all day. So that's part of why I'm glad y'all can't see me on camera because I'm like scratching over here like crazy. Lipid lowering drugs are used to, hang on, I missed a word and it threw me off in there. It's used to lower the level of lipids. Lower the level of lipids in the bloodstream. Lipid lowering drugs are used to lower the level of lipids within the bloodstream. You have 4 main types of statins. You have 4. I don't know why this slide is. There are 4 main types. Statins, fibrinates, nicotinic acid, and its associated derivatives and drugs that bind to bile salts. Lipid lowering drugs are used to lower the level of lipids within the bloodstream. There are 4 main types: statins, fibrates, nicotinic acid, and then its associated derivatives, and drugs that bind to bile salts. The statins will reduce the formation of cholesterol and triglycerides within the body. Side effects of statins may include nausea, headaches, abdominal pain, and diarrhea or constipation. With long-term use, there is a possibility that statins may affect liver function. Statins cross the placental barrier, therefore they should not be taken by pregnant or nursing mothers. Commonly prescribed statins are Lipitor, Lovastatin, Crestor, and Zocor. Fibrates are effective in lowering levels of both cholesterol and triglycerides within the blood. However, they should not be used by patients with kidney, liver, or gallbladder disorder. Side effects can include muscle pain, nausea, headache, and erectile dysfunction. Fibrates should not be taken by pregnant or nursing mothers. Commonly recognized brand names will include Lopoid, Tricor, and Atramid S. Nicotinic acid and derivatives are used in the reduction of excessively high levels of cholesterol or triglycerides in the blood. Side effects may include facial flushing, unsteadiness, headache, nausea and vomiting, and itching. Women who are planning a pregnancy or who are pregnant or breastfeeding should avoid these drugs because they can harm a fetus or baby due to side effects, and therefore these drugs are only to be used when others have been proven to be ineffective. Drugs that bind to bile salts will lower blood cholesterol by reducing fat absorption from the intestines. These drugs may be used in combination with other lipid-lowering drugs, such as fibrates and statins. Drugs may bind to bile salts, have few side effects, although they sometimes can cause nausea, abdominal discomfort, and constipation. These drugs will also reduce the body's absorption of vitamin K. Therefore, supplements of vitamin K may be necessary in long term. Other lipid-lowering drugs will include, I'm going to have to Google that one. I feel like this is probably one of the worst ones for me to do on live because it's got easy ETINIBE. I don't know how to pronounce this one. I'm gonna have to listen to this one too. Azatum. Yeah, I don't know. Hang on, I'm gonna have to listen to it. Here we go.
Ezetimibe, brand Zetia. Ezetimibe is a cholesterol.
Ezetimibe. Yeah, I would have never gotten that one either. And it's weird how, like, I can say the ones that, like, a lot of people can't, but then the ones that are, like, a little bit more simple are the ones that always trip me up. Ezetimibe. Okay. Other lipid-lowering drugs include ezetimibe and omega-3 compounds. These are generally used in combination with statins and dietary measures. And possible side effects of ezetimibe will include gastrointestinal disturbances, headache, tiredness, and muscle pain. Omega-3 compounds may cause gastrointestinal disturbances, and then other side effects associated with lipid-lowering drugs are rare. Ezetimibe is marketed under the brand name Zetia. Respiratory disorders. It's funny how, like, I have it in my head that I'm saying something and then I read it and it totally doesn't come out. I think it's because my brain, like, thinks 4 words ahead as I'm saying it, and that's what my problem is I can read faster than I can talk. So I'm reading like 3 and 4 words in front of my word. Respiratory system disorders will include conditions that affect the airways and lungs range. Hang on, what am I trying to say here? Respiratory system disorders include conditions affecting the airways and lungs. They can range from minor illnesses to long-term. Okay. Respiratory system disorders include. Respiratory system disorders include conditions affecting the airways and lungs. They can range from minor illnesses, such as the common cold, to long-term disorders, such as asthma. Drugs used in the treatment of respiratory disorders can be used short-term for minor illnesses or long-term for treatment of asthma and COPD. Long-term disorders may be severe and require the use of bronchodilators. Bronchodilators dilate the bronchi of the lungs. They widen the airways, preventing or relieving symptoms of asthma and COPD, such as wheezing, tightness of the chest, and shortness of breath. Bronchodilators are divided into 3 main groups. I'm not going to be able to say that one easily tonight either. Sympathomimetics. See, I have to and then anticholinergics and xanthines. Bronchodilators will dilate the bronchi of the lungs. They widen the airways, preventing or relieving symptoms of asthma and COPD, such as wheezing, tightness of the chest, and shortness of breath. Bronchodilators are divided into three main groups. Nope, I can't do it. Sympathomimetics. Sympathomimetics. Bronchodilators will dilate the bronchi of the lungs. They widen the airways, preventing or relieving symptoms of asthma and chronic obstructive pulmonary disease, such as wheezing, tightness of the chest, and shortness of breath. Bronchodilators are divided into three main groups: sympathomimetics, anticholinergics, and xanthines. Sorry, I have a thing here on my screen I have to get done, so I had to pause for a second. Sympathomimetics. Okay, I only have to say it twice on this slide. So fingers crossed I can do it. Inhaled sympathomimetics are used at the first sign of symptoms or to prevent symptoms from developing. They are accompanied by... I can't even say the word accompanying now. They are accompanied by side effects. I don't like the way that's worded, though. They're used in conjunction with side effects, such as... No? No, they are. I see what it's saying. I see what I was trying to say. The use of... can result in side effects such as inhaled sympathomimetics are used at the first sign of symptoms or to prevent symptoms from developing. The use of sympathomimetics can result in side effects such as slight tremor, agitation, insomnia, and rarely a rapid heartbeat. The common brand names are Proventil and Ventolin. Anticholinergics are often used in combination. All right. Anticholinergics are often used in combination with sympathomimetics to treat chronic obstructive pulmonary disease. They too have a number of common side effects, including dry mouth, difficulty in passing urine, and blurred vision. In rare instances, the anticholinergics have been known to cause an acute glaucoma attack. Common brand names are Atrovent and Spiriva. Xanthines are bronchodilator drugs, and I don't like the way I said that. Xanthines are bronchodilator drugs, which have a prolonged action and act on the muscle cells of the airway walls, causing them to widen or dilate. In preventive circumstances, xanthines are administered orally. However, in circumstances of severe attack, the medication is administered via IV drip. Common side effects associated with xanthines will include nausea and headaches. High doses may cause a rapid and irregular heartbeat, and your xanthines are marketed under the common brand names of Theophylline, Theodur, and Slowbid. Musculoskeletal system drugs will include non-steroidal anti-inflammatory drugs, or NSAIDs, anti-rheumatic drugs, and muscle relaxants. Musculoskeletal pain often results from a minor muscular injury, and medications are prescribed to relieve the pain while the problem resolves. Serious disorders causing persistent pain or disability will require long-term medication that is needed to control those symptoms. Non-steroidal anti-inflammatory drugs, or NSAIDs, are non-opioid pain relievers, and they're used to relieve pain and inflammation, particularly in muscles, ligaments, and joints. NSAIDs are generally taken orally. However, on occasion, they may be administered topically or via injection. Certain NSAIDs are available in a slow-release form, which may be effective for up to 24 hours, providing a more constant level of pain relief. Side effects of NSAIDs will include nausea, indigestion, bleeding from the stomach, and occasionally peptic ulcers. Allergic reactions will include rashes and a condition called angioedema, temporary painless swelling that develops in the skin and mucous membranes. Other NSAIDs, such as diclofenac and ibuprofen, when used at high doses for long periods, may also increase the risk of heart disease and stroke. Given the side effects and risks associated with NSAIDs, they should be prescribed at the lowest effective dose for the shortest amount of time. Commonly prescribed NSAIDs will include ibuprofen, diclofenac, and naproxen. Anti-rheumatic drugs are used in the treatment of rheumatoid arthritis and certain other conditions caused by autoimmune diseases, such as systemic lupus erythematosus. The main drugs used to treat rheumatoid arthritis are known as disease-modifying anti-rheumatic drugs, or DMARDs. These drugs modify the disease process itself by altering the activity of the body's immune system. The alteration will cause a reduction in symptoms such as pain and inflammation, and it can also limit further joint damage. DMARDs are two forms. You have immunosuppressants and biologicals. Biologicals are new, and they will reduce the level of chemical tumor necrosis factor alpha, or TNF alpha. And TNF alpha is the chemical that plays a role in the joint inflammation. Therefore, treatment of your biological will reduce the pain and stiffness that is associated with your rheumatoid arthritis. Muscle relaxants are used to relieve muscle spasms. They are also used to ease the movement of limbs that are stiff because of nervous system disorders such as multiple sclerosis and cerebral palsy. In addition, there are sometimes prescribed, not subscribed. They are prescribed muscle relaxants are used to relieve muscle spasms. They are also used to ease the movement of limbs that are stiff because of the nervous system disorders such as multiple sclerosis and cerebral palsy. In addition, they are sometimes prescribed to treat conditions such as nighttime muscle cramps and torticollis. Muscle relaxants will work in a variety of ways. Some work by reducing transmission of nerve signals from the brain and spinal cord to the muscles, causing the muscles to relax, while others will relieve spasms by acting directly on the muscles, making them less sensitive to nerve signals that are sent from the brain and the spinal cord. The most common side effects of muscle relaxants is drowsiness. With long-term use, the body may become dependent on the drug, causing the spasms to worsen if the medication is suddenly withdrawn. Commonly prescribed muscle relaxants are diazepam or Valium, metaxalone or Scalaxin, and carisoprodol or Somo. Antimicrobial, specifically antibiotics, are used to treat bacterial infections and are among the most commonly prescribed medications in the world. Antibiotics work either by killing bacteria directly or by stopping their multiplication so that the body's immune system can overcome the remaining infection. Antibiotics are classified in groups such as penicillins, cephalosporins, and tetracyclines. One of the most commonly used groups of antibiotics is your penicillins. Antibiotics that work against a wide range of bacteria are also called broad-spectrum antibiotics, while antibiotics that work against only one or two types of bacteria are known as narrow-spectrum antibiotics. Antibiotics are most commonly used for the treatment of short-term minor infections, such as ear infections, throat infections, or UTIs. The drugs may also be used in the treatment of serious infections, such as septicemia and bacterial meningitis. Low-dose antibiotics are used for patients with a reduced immunity to prevent infection, such as those with HIV or AIDS and people who are taking immunosuppressants. Antibiotics can be administered orally, topically, or intravenously, and most bacterial infections are treated with oral antibiotics. Eye and ear infections can be treated with antibiotic drops, and when you have high-dose antibiotics that are required, the medication can be administered either intramuscularly or intravenously. The most common side effect of an antibiotic is diarrhea. And in addition, your antibiotics can alter the balance between normal bacteria and the yeast candida that occurs naturally in or on the body. And this imbalance can lead to an overgrowth of yeast, which results in oral or vaginal thrush. In rare instances, your antibiotics can destroy harmless bacteria in the bowel that will prevent the growth of disease-causing organisms, causing diarrhea and severe dehydration. Penicillins can cause rashes and in some people a rare life-threatening allergic reaction known as anaphylaxis. Tetracyclines can cause changes to growing bones and teeth, and therefore they are not prescribed for young children or pregnant women. Antifungal drugs are used to treat infections that are caused by fungus. Fungus can cause a wide range of infections in many areas of the body. Antifungal drugs will address the infection by damaging those fungal cells. Once the walls are damaged, vital substances within the cell will leak, therefore it destroys the fungus. Antifungals are frequently used to treat minor fungal infections of the skin, such as athlete's foot and ringworm. And these types of drugs are also effective against candidiasis, which is a common fungal infection that can affect moist areas of the body, the mucous membranes that line the mouth, and the vagina. Antifungal drugs may also be used for the long-term treatment of potentially serious fungal infections, such as aspergillosis, which may affect the lungs and spread to other organs. Aspergillosis is a condition in which certain fungus infect the tissues, and it is most commonly affecting the lungs, owing to inhalation of spores from moldy hay, and then it is informally called farmer's lung. Administrations of antifungals can be topical, oral, or intravenous. Topical preparation is most often used for skin infections. Oral administration is used for skin infections when topical preparation has been found to be ineffective. And then it's also used in the oral thrush. If the fungal infection has led to a serious infection of internal organs, then your IV administration will be utilized. There are generally no side effects with topical antifungals. However, in some instances, irritation may occur. Potential antifungals may cause nausea and vomiting. In rare circumstances, antifungals may cause kidney damage and blood disorders. The most commonly prescribed antifungals are nystatin, fluconazole, and I'm going to have to record that because I have to figure out how to say those. Fluconazole and clomitrazole. So I know I have it, but when I'm saying it in like the mean, like while I'm saying it, I second guess it and then I stumble. Because I always want to say too, fluticasone. I know that's not it, but that's the first one that comes to my mind. So like I start to say flucon and then I think fluticasone and then I so there's so many ones that are like so similar but yet completely different. Yeah, and I feel like I talk really fast too, so I'm trying to not. My boss at work tells me all the time, she's like, you need to slow down. Just slow down. Just take a breath. But then I feel like whenever I slow down, I feel like I'm talking like this. So I have to find that happy medium for sure. Administrations of antifungals can be topical, oral, or intravenous. Topical preparation is most often used for skin infections. Oral administration is used for skin infections when topical preparation has been found to be ineffective, and also in the use of oral thrush. If the infection has led to a serious infection of internal organs, then IV administration can be utilized. There are generally no side effects with topical antifungals. However, in some instances, irritation may occur. Potential antifungals may cause nausea and vomiting, and in rare circumstances, antifungals may cause kidney damage and blood disorders. The most commonly prescribed antifungals are nystatin, fluconazole, and clomitrazole. Antiviral drugs are used to treat viral infections that can recur or persist over long periods of time, such as herpes, HIV, and chronic Hep B and C. Antivirals such as acyclovir are most commonly used to treat herpes simplex infections in people who have severe or recurrent genital herpes or cold sores. These drugs are also effective against the varicella zoster virus, which can cause chickenpox as well as shingles. These drugs generally do not produce any side effects, although on occasion, when taken orally, they may cause nausea. Acyclovir, when given by injection, rarely may cause kidney damage and produce symptoms such as confusion and seizures. Anti-cancer drugs are used to destroy or slow the growth of cancerous cells. Cancers are a broad group of diseases in which abnormal body cells will form and multiply, interfering with the function of surrounding tissues. Treatment with these drugs, such as chemotherapy, is normally managed by an oncologist, which is a doctor who specializes in the treatment of I don't know why I stumbled over that one. My eyes jumped on that line. Anti-cancer drugs are used to destroy or slow the growth of cancerous cells. Cancers are a broad group of diseases in which abnormal body cells will form and multiply, interfering with the function of surrounding tissues. Anti-cancer drugs either destroy the cancer cells or prevent them from spreading. Treatment with these drugs, such as chemotherapy, is normally managed by an oncologist who is a doctor that specializes in the medical treatment of cancer. Anti-cancer drugs may be given with the aim of curing the cancer, prolonging life, or relieving symptoms. And in some cases, chemotherapy is used in combination with surgery and or radiotherapy. Cytotoxic drugs will act directly on the cell's genetic material or DNA and then prevent the cells from using the nutrients that they need to divide normally. The effect of drugs is concentrated on areas of tissue where cells are rapidly dividing, therefore effective in treating rapidly growing cancers. Some cytotoxic anti-cancer drugs, such as methotrexate, I struggled on that one. Hang on. Let me go through and make sure there's not any other weird ones in there I need to prepare my brain for. All right. Let's try it again. Cytotoxic drugs act directly on the cell's genetic material or DNA and prevent the cells from using the nutrients that they need to divide normally. The effect of drugs is concentrated on areas of tissue where cells are rapidly dividing, therefore effective in treating rapidly growing cancers. Some cytotoxic anti-cancer drugs, such as methotrexate, are also used to treat non-cancerous conditions such as severe psoriasis and rheumatoid arthritis. Cytotoxic drugs are usually administered within the hospital, and several short courses of the drugs are given over a number of weeks, with drug-free periods in between to allow time for the normal body cells to recover. Cytotoxic drugs can cause severe side effects because they affect any area of the body where there is rapid cell division, such as your bone marrow, your hair follicles, and then the lining of the mouth and the intestines. Damage to bone marrow can reduce the number of platelets, red and white blood cells, and then some anti-cancer drugs may also cause folic acid deficiency. These problems can lead to anemia and increased susceptibility to infection, and then reduced clotting ability. Nausea and vomiting are particularly common side effects of cytotoxic drugs, and they can be severe. Certain types of cancer whose growth is influenced by hormones may be effectively treated with hormones and hormone antagonists. This treatment may be used following surgery or radiotherapy to prevent any remaining cancer cells from growing and spreading. The treatment may involve the use of a hormone that halts the progression of cancer. So, for example, progesterone is used to slow the progression of cancer to the uterus. Alternatively, a hormone antagonist drug can be used. Drugs of this type will oppose the effects of the hormone that stimulates the growth of cancer. For example, hormone antagonists such as tamoxifen are often effective in slowing the progression of certain types of breast cancer that are stimulated by the female sex hormone estrogen. This drug will block the action of estrogen on the breast cells. Hormonal drugs are usually taken orally or injected, and sometimes treatment is continued for several years. Hormonal drugs generally will have milder side effects than cytotoxic drugs. However, treatment with tamoxifen will slightly increase the risk of developing cancer to the uterus. And I just realized I do not have an ending slide to this one. So let me create an ending slide here real quick, So Secura, this is information that it can't hurt to know for sure. It's not anything that from a CPC standpoint, there's not really a whole lot that they're going to ask specific pharmacology wise, but it is good to know the information because it kind of helps break down some of your what's the phrase I'm trying to say? It kind of helps break down certain treatments of conditions, I guess is the best way to put it. And then I just realized that this needs to be something different. Hang on, guys. Maybe not. All right, I gotta do a ending slide. I didn't realize. About one-on-one sessions, Glenda. Which one-on-one sessions are you talking about? The standalone sessions that we're working on that we haven't rolled those out yet. But yeah, if you want to shoot me a message, I'm happy to talk about them. Like I said, we don't really have a whole lot of details yet because we're still working on kind of structure and whatnot of them and trying to see if we can even get our website to like support that type of thing, because it's going to be different from our, obviously, the full AAPC course, because the AAPC course is housed in their learning center, and so we would have to figure out how to kind of build our website to support that type of ask, because it's going to be structured differently than just a like just a CBT, not a CBT, but like a, what's the word? Like a recording or something along those lines. Like, if you guys could see how bad my face is, like, red because I've been scratching because I'm itching so bad. I'm going to have to take some allergy medication and knock out tonight. I have been coding since 2007, 2008. I got certified in 2007, got my first job in 2008. So, end slide. Sorry, I have the hiccups. All right, very last slide. And then you all will be done hearing me ramble tonight. It literally is just an end slide. It's nothing fancy. So this concludes the pharmacology module. Please complete the assessment for this section and continue to the next module. All right, so look, this is what I like. This is the crazy stuff. It took me How long did it take me? An hour and a half to do 34 minutes of slides. So when I tell you guys, like, it is not as simple as just recording things. There's a whole lot that goes into it. You saw how many times I had to re-record certain slides, how many times I had to just change verbiage, things along those lines. So just know, oh dang, I'm like dropping you guys all over the place. Just know that, like, it does take a lot. So whenever I say it's coming, I promise it's coming. It really does take a minute for me to do stuff. So, but now that I have finished, do you guys have any questions? Anything you guys want to chat about? Because I'm going to sit here and save this and get this exported. You've tabbed your PCS book the entire time. Good job. Yeah. I am one of those that if I can have background noise, I'm so much more productive, for sure. Yeah, like, look at this. You all can't see because my light isn't showing it. You can see, like, I'm getting heavy over here. Worked on getting your CPT book prepped. Yeah. I am a multitask, have background noise that is somewhat gonna make it. Have I tried Allegra? I take every single day. I take Montelukast and I take, I don't take Allegra, but I take Zyrtec. So, but something in the air today has me like super, super heavy. So I'm going to have to take my hydroxyzine later on tonight, which I've got to find that because I haven't had to take it in a while. It's spring. I live in Kentucky and our allergies and our pollen are absolutely insane right now. It hasn't rained in a couple of days, so there's just a ton of crap in the air and everybody's been cutting grass, and it's probably honestly the ragweed, if I had to guess, because I can feel it. How do I write in the margins of ICD-10? To be honest, I need to figure out a good way to write in the margins of ICD-10 because I have it, in the PDF and not in the book. So I need to get it in the margins and show you guys a good way to do it. Mary, I do have more shirts. So I have, which actually this is mine. This is just a hoodie. I'm not selling hoodies right now, but I'm doing the t-shirts. I have an order going. Well, no, I'm probably going to wait to do it. I'll probably wait another week because I haven't gotten enough orders to really kind of make it worth it. So I need to send out an email to the 4 people that have ordered and let them know it's going to be an additional week. But I do have shirts. I have an order that will go in next Sunday, for shirts. So if you go to the link up in my bio, let me show you what I mean by the link in my bio. If I can get to it on my phone. Yeah. So if you go to the link in my bio and you click there, then the very first link that pops up is a t-shirt order. And then it's going to take you to, not share. Come on. There we go. It's going to take you to the order form. And then you'll fill out your size and your color. This order is going to have 4 different colors: pink, gray, blue, and black. And then it is going to be this here. It's going to have my logo somewhere here. There we go. It's going to have my logo here. And then on the back, it has, and let me show you. Let me pull it up so that I'm not just standing here showing you guys. And have it on my phone somewhere. Here we go. This is what it's going to have on the back. So the pictures on the order link as well. So the shirts are going to be 30 if you're doing small through extra large, and then 32 if you need a 2X or a 3X. But they are in there for sure. If I have like enough interest, I'll do hoodies the next time. Then I don't know. I haven't decided how much I'm going to charge for those because they're not cheap to get, and I just have them because I'm a hoodie wearer. I just noticed I have like I can't tell if it's the lighting or, yeah, no, I've got some circles. They're not terrible, but it's not as bad as what the lighting makes it look like. What if you're not certified yet? I have some people that have gotten them that aren't certified, and they're just using it as their motivation to become certified. So you can absolutely still get one even if you're not. It's not I'm not going to do a check on you to make sure you're certified before you get the t-shirt or anything. It's just a cute little thing to say. I was not planning on turning my camera around, so I'm looking a hot mess. You want to wear one and order it to your exam? That's a cute idea. I was trying to decide what I wanted the back of it to say, but since we have so many different certifications that everybody's studying for, then I had this little disclaimer that code sets and certifications may vary based on the location and specialty. Just because, it's that way if you're a CPC, if you're a CCS, if you're a CPMA, depending on whatever you're doing, then it's good for whatever. And then I'm sure everybody can relate to the whole pen snob because, me and I love my certain pens to write with. We have to eventually learn computers whether we want to or not. The upper arm strength is because we have to carry around those massive books, soaking up knowledge, and then requires caffeine because obviously it takes a lot to get through everything. So I thought that was really cute. All right, guys. Well, I am going to hop off of here. I don't know if I'm going to record anything tomorrow, if I'm going to take the day and do nothing tomorrow. So Glenda, we have CPB, CPC, and then we have the CRC. So we have the risk adjustment certification. All right, guys. Well, I'm going to hop off. If you need anything, shoot me a message. And if I don't talk to you before we do book prep from a subscription standpoint tomorrow, then I'll talk to you at 6 p.m. Eastern Standard Time. Again, I have not completely decided if I am going to do anything like recording wise or live tomorrow besides the book prep for the subscription. But if I don't talk to you guys before 6 p.m. tomorrow, have a good night and I will chat with you soon.